2017-18 and 2025-26 has seen increase in 46.8% increase from 17 lakh in 2018 to 25 lakh in 2026. The MHIS claims from 2017-18 today has seen a 60% increase. This shows the confidence of people in our facilities and effectiveness of our schemes. Sir, the contribution of the state saving mother and child has matched and exceed about 120 crores by state in the last 4 years against 110 crores by the government of India, excluding MHIS. With MHIS included, it will be 170 crores. Sir. Chief Minister Save Motherhood scheme provide unlimited free transportation to women and children, unlike the previous national program which give only for delivery. Over 1 lakh trips are made every year, sir, through the CMSMS transit vehicles. Sir. Provide transit home for women and children to stay, sir, because most of the challenges we face, sir, in the past that people, women, they are hesitate to come because they don't have nobody to look after their children. But after having this transit home, they can bring their children along with the trained birth attendant, where after the government paid them, sir, provide assistance for diagnosis and provide financial assistance to husband and traditional birth attendant ₹1,000 per delivery, sir. Our maternal death have fallen over 56%, the first in the history of our state, sir. Our infant death have fallen over 40% in the state from 2020-21 data. For the first time, we have completed online system of tracking pregnant women, mother app to the village level on the mother app, sir. We are making MHIS cashless to the extent possible in all hospitals, sir. Infrastructure, sir, for the first time, the state will achieve more than recommended health facilities by March 2027. PHC 121, CHC 35, subcenter 700 as per national norm. We have invested over 750 crores in the last 5 years to add over 1,000 beds in our health system. The state has highest first referral unit today in comparison to the previous year. The village health council are engaged in building their health infrastructure by themselves. They have built over 100 sub-centers and will build 150 more by March 2021. Human resource, for the first time, over 400 medical officers were recruited in one go under the Meghalaya Medical Services Recruitment Board. Over 300 contractual nurses were appointed at various district hospitals. The housekeeping and cleanliness of various district hospitals have been taken care with adequate manpower. We have trained over 115 doctors in 6-month certificate courses in Tamil Nadu on matter relating to maternal and child health. Yes, indeed, an area of concern when it's come to specialists. We are trying to keep up with the growing demand with medical colleges converting district hospital into teaching DNB courses. Other initiative on mother and child health, training of traditional birth attendant in identifying danger sign and referring mother to hospital, encouraging participation of village health council in antenatal and postnatal care, taking the support of faith-based organization to send the message on awareness through ECD missions. Sir. So these are, sir, the effort being taken from the department to see that our institutional delivery will reach or rise above the national average, sir.
And my last question, sir. Through you, I would like to ask the Health Minister, against the sanctioned post of medical officers in the state, what is the number of shortfall? Or in another way of putting it, how many doctors we are yet to recruit to fill up the posts that are already having sanction?
So right now I don't have the data, but this much I can say. We don't have, out of the sanctioned posts, most of the MO have been filled, but there is a huge shortage in terms of specialists. We have huge shortage because we have, and we have done a series of recruitment, and even recently also, sir, we have called for the recruitment but very few turn up, and even with the 3 PHCs, which we don't have medical officer, after recruitment, when we give them the posting, then they didn't turn up, sir. But I assure the House that out of these 3 PHC, which don't have the medical officer, the medical will be sent, but we'll try to send it by today or by next week.
Yes, Mr. Singh Chim Sang, please.
Honorable Speaker, sir, may I know from Minister, what is the district-wise breakup institutional delivery in Meghalaya? Which districts are farthest below the state average of 58.1%?
Yes, sir. Give me a second, sir, because the details is here. Yes. So the question from the honourable member, he want to know regarding the district. The district-wise, the overall, sir, I can give the according to the report and the from the NFHS 6, sir. These are the interpretations, sir. Assessment. Best overall is West Garo Hills, most consistently strong across service delivery indicator. South Garo Hills, very strong institutional delivery, vaccination, child nutrition outcome, ANC remain a weakness. East Garo Hill, relatively strong, good immunization and several service indicator with weaker ANC coverage. Southwest Garo Hills, middle or mixed, relatively favorable child nutrition but weak ANC. Ribhoy, middle and mixed, good ANC but weaker nutrition performance. East Jaintia Hills, middle and mixed profile, serious stunting and institutional delivery concern but low wasting. North Garo Hills, middle and mixed, relatively favorable stunting but very weak ANC. Southwest Khasi Hill need attention, very strong ANC, contact but poor institutional delivery and high stunting. East Khasi Hill need attention, strong literacy context but weaker performance on several health service indicator. West Jaintia Hills weak across several maternal and reproductive health indicator. West Khasi Hill weakest of all, high stunting, low institutional delivery and high child marriage despite very high ANC coverage.
Thank you, sir. And I have another question. What is the urban-rural gap in institutional delivery within Meghalaya, especially, and this gap widen or narrow since NFHS 4?
So I don't have the exact number of the gap now, but from the report, sir, the gap has decreased, sir.
Thank you, sir. I know, in view of the typical geographical terrain and connectivity problem under my constituency, E, 59 Chokpot LAC, will the government consider and strengthening the delivery facilities, manpower, ambulance services, and referral system in the area so that pregnant women do not have trouble to long distance for delivery?
Definitely, sir. This is the endeavor of the government, sir. That's why we come up with the Safe Mother scheme as well, because we do realize that Meghalaya has a very difficult terrain, and definitely, sir, the concern of the honourable member is well taken, and the department will try its best to give the best service to the people of Chokpot and the whole state.
Thank you, sir.
Dr. Mizanur Kaji, please.
Thank you, Mr. Speaker, sir. I also would like to thank our young and dynamic Health Minister, sir, for his endeavor to upgrade the medical facilities of the state. Sir, as I could see that there is 65.6% of institutional delivery as per NFS HS6 survey. May I know from the Honorable Minister in charge how many percentage of them are in private and how much are in government setup out of that 65.6%?
Oh, I don't have that details with me, but if you want, I can provide it. I can lay the table to the House, or I can provide it personally to the members.
Thank you. Mr. Speaker, sir, I would definitely like to have the data from the Honorable Minister. My next supplementary would be regarding this MHIS facility provided by the government. I hope the department especially is aware of the fact that this MHIS card is very much dishonored in private institutions, especially many of the private institutions in Assam. And as a matter of fact, I have experienced it myself also. And their reply in this regard is that there is non-payment from the government of Meghalaya. So the needy, the poor and needy are being deprived of the facility. That is number one. And number two, wherever it is accepted also, it's a matter of fact that whatever government appropriate is there, patient have to pay extra under table. So may I know from the Honorable Minister that what are the steps that are being taken to ensure that MHIS card is respected fully and it is accepted throughout the impaneled hospitals?
Sir, actually, because the main principal question was NFHS 6, but I don't have the detailed data or report on that. But I assure the honourable member that the government is taking steps, and also at the same time that we try to resolve whenever any concern and any issue come reported from the department, sir. We try to resolve it, and most of the time, sir, we try to make sure that the maximum benefit should be availed from the MHIS. Even, sir, just for the benefit of the House and to the people of the state, sir, I just want to inform that from the MHIS, 30,000 rupees have been kept for the ANC checkup for the pregnant woman, whether in the private hospital. But for I don't have the exact details, but this I can assure the honourable member that his concern is well taken, and definitely the government will address the issue, sir.
Thank you, Mr. Speaker, sir. I thank the Honourable Minister for his assurance, and I sincerely hope that this will be taken up with the respective impaneled hospitals with highest priority. My third supplementary would be through you, Mr. Speaker, sir. As you could see, the gain of 7.5%, it took almost 4 years. So, at the same pace, we would be achieving approximately 73% by 2029. So, may I know from the Honourable Minister in charge, what are the extra proactive steps we are taking so that we can achieve the target at the earlier level?
Sir, I would like to inform the honourable member and as well the House that this National Family Health Survey 6, it's done in the year 2022-23. So after that, sir, it has been 2 to 3 years now. And major, and I think I already read all the initiative just a few minutes ago, all the intervention and the effort being made by the government. And I would like to inform the member and the House that, sir, according to the health management information system, sir, right now the institutional delivery of Meghalaya stand at 81%, sir. No doubt, sir, maybe at this point of time, because it was 3 years ago, it was 65.6. But right now, sir, at present time, it is 81%. And we are quite, have high confidence, sir, because of this effort and initiative and looking at the growth. So by the next NFHS 7, sir, we confident that we'll be above, at par or above the national average, sir.
Mr. Speaker, sir, may I know from the Honorable Minister in charge, how many first referral units are fully functional in the state with operation theatre, blood bank and specialist? And how many of them are more than 2 hours drive from the hospital? How many of them are more than 2 hours drive?
So the completed or the functional FRU in the state right now are 6, sir. 5, sir. Under construction is 3, sir. And the under evaluation stage are 3, sir. So out of this, like I mentioned, sir, 5 have been completed and functional. And no doubt, sir, right now I don't have the breakup details of all the manpower and the other human resources present. But, sir, these are functional and the cases are being admitted, sir. But, and at the same time, sir, I don't have the distance, the location distance right now. So I think I'll require notice for that, sir.
Mr. Speaker, sir, though it is not a supplementary question, through you, I want to have a submission to the Honorable Health Minister. Sir, if I am not wrong, Bhaitbari CSC is, I think it comes second in the district in terms of institutional deliveries. In this regard, I would, through you, Mr. Speaker, sir, I would like to request the Honorable Health Minister, sir, to kindly upgrade the facilities in the CSC for institutional deliveries. Like we need a specialist at the earliest, and even I had met Honorable Minister, sir, for a blood bank also, because our pregnant mothers, they are anemic. So through you, Mr. Speaker, sir, my humble submission would be to kindly provide a blood bank and a specialist to Bhaitbari CSC, as it is one of the as it is attending one of the highest institutional deliveries in the West Garhwal district. Thank you, sir.
Sir, the point well taken, sir, and I share with the concern and the sentiment of the honourable member. And like he rightly mentioned, sir, he has met me for this particular issue, sir. And from the department, sir, we are trying our best. But like I mentioned, sir, the major challenges which we are facing right now is having specialists. So that is the main challenging we are facing. But nevertheless, sir, point well noted, well taken, noted, and then the department will try to support whatever necessary and possible, sir.
Bakar Pran, please.
Thank you, Mr. Speaker, sir. May I know from the Honorable Minister in charge of Health and Family Welfare, how many CHCs in the state presently have functional 24/7 delivery services?
Sir, right now, sir, all the district hospital and the FRU, sir, are 24/7 delivery, sir.
What about CHC, sir?
Yes, CIC, which are FRU.
Okay. Another question, supplementary question. How many CHCs have facilities for emergency obstetrics care, C-section, and newborn care?
Sir, all the CIC, sir, you mean?
Yes, yes, you.
CSC, sir, all these CSC, sir, are functional and most of the for emergency. But right now, sir, I don't have the details of how many mostly, sir, the C-section are being done in FRU.
Mr. Speaker, sir, may I know from the Honorable Mr. in charge of Health and Family Welfare whether the government has identified that because of the delays in transporting pregnant women from remote villages lead to maternal and infant deaths?
Yes, sir, because like I already mentioned in my previous reply also, because in the past, sir, where after the mother program came, along with the Chief Minister's Safe Motherhood Scheme, sir, the major challenges or the major cause of the demise of the mother during pregnancy, we find is the terrain or the absence of the vehicle to take the mother to the institutional deliveries to the hospitals. So that's why, sir, keeping in mind all these issues, so that's why, sir, we came up with the Chief Minister Safe Motherhood Scheme, and for this I must thank the Honorable Chief Minister for coming up with this very beautiful program, which have really helped, like I already mentioned in my previous reply also. Even last year, sir, last year itself, more than 1 lakh trip have been made by this vehicle, sir, taking the mother from the rural areas to the hospital, sir.
Sir, Mr. Speaker, sir, seems that the government has set a strategic target for this institutional deliveries. The target is aimed at improving maternal and child health and reducing maternal deaths. I want to know the Honorable Minister, what are those key interventions?
Sir, I think I already read myself. I already give an extensive reply in the question of on the question asked by the questioner. So I think I already replied, sir.
Okay. So, may I know from the Honorable Minister whether the shortage of specialists, doctors, particularly gynecologists, pediatricians, and anesthetics in CHC and other health facilities is affecting maternal and child health care services?
Yes, sir, definitely. I think it is clearly the question already raised by the questioner itself at the very beginning that manpower play a very important role, sir. And then I think myself also, I already informed, sir, that right now, sir, the biggest challenge which the government faces is the absence of the specialists in the state itself, sir. The government have gone for recruitment, sir, but due to the shortage, that's why, sir, we are unable to recruit, sir.
Last question, sir. So I just request the Honorable Minister, since in our PHC Dinpaso, we didn't have that ambulance service, sir. I want to know when they will provide that ambulance service. And another one, at CHC Mountain, we have been complaining since the last 2 years for construction of ramp for lifting a patient from ground floor to upstairs. But till now, no ramp has been constructed.
Yes, sir. Regarding the ambulance, sir, I'm also aware, sir, regarding the issue, sir. And then I think some of the groups also have came and met me. Sir, I just want to inform the House and to everyone that, sir, the department is in the process of procuring the ambulance, sir. So as soon that is done, sir, we'll try that Deng Pasok will be one of the facilities will be provided with the ambulance. And then definitely, sir, I assure the member that I will look into the RAM issue also. We'll try to resolve it as soon as possible.
Okay, thank you.
Okay, Mr. Rakam Sangma.
Speaker, sir. So I think the dynamic and the young and the bachelor health minister is doing the good things. The coach knows better than the player. Sir, my small supplementary question through you, sir, to Honorable Health Minister. So NFF 6 is 65.6% in the state. So may I know the reason why? Of course, our state institutional delivery is 81% as of now. So what are the reasons, what are the factors that why we cannot achieve 100%? What are the factors do we have, sir?
Yes, sir. So the main reason for hesitation toward institutional delivery are, sir, is the help-seeking behavior, sir. Home delivery in Meghalaya is influenced by a combination of social, cultural, geographical, and behavioral factor rather than being a rejection of institutional healthcare. Social and cultural factor: traditional preference for home-based childbirth, trusted local attendant, family decision-making, and customary practices. Geographical factor: difficult terrain, scattered settlement, long travel distance, and seasonal accessibility challenges, particularly during monsoon and at night. Economic and household factor: transport-related expenses, loss of wages, and difficulty arranging care for children and household responsibility. Perception and past experience: preference for familiar or female provider, concern regarding referral or surgical intervention, and apprehension based on community experience. So these are few of the major challenges, sir, which the department is facing, sir.
Speaker, sir, I agree with all this reasons stated by our health minister. Sir, I have experience. I belong to the region where the most underdeveloped constituency in the state, I can say, sir. So I have 58 polling stations. During 2018, it was only 19 polling stations where the vehicle can reach. But today, because of Honorable Chief Minister, many roads has been constructed. So only 2 polling stations which is not motorable today. So because of all this initiative, be it Mother Care Program, Mother's Aid Program, so this has been increased because of various initiatives of the government, sir. So however, I have experienced that who is my auntie. Most of the time from Bakmara, from South Kal Hills, the complex cases of the pregnant mother always refer to the Tura. There has happened to be my auntie, she was referred to Tura, but on the way she delivered the baby. Unfortunately, the infant could not survive, but the mother, fortunately, she could be survived. So there may be cases of such in many PHE and the CHE. So the two things is very important: the ambulance and the sonograph missions. So do we, as I have already discussed, in all the PHEs or be it CHE, because today we have all the nurses, the ASA, Anganwadi worker who connect with all the mothers, pregnant mothers, to bring to the hospital here and there. Sir. But my question is, sir, today, because ambulance play a very important role, and it also connect with the economics of our people. So my question, sir, my supplement question is: do we, all the PHCs, CHC, are all functional ambulance and sonograph mission, which is important for the mothers?
Right now, sir, no. So that's why, sir, looking at this particular challenge, sir, mentioned by the honorable member, that most of the cases, the reason of the demise of the mother is mostly because they didn't reach on time, late arrival or late referral. So that's why, sir, keeping in mind, that's why particularly we come with this Chief Minister Safe Motherhood Scheme. So just to inform, sir, here we give free transportation for the mother, not only for during delivery, but for ANC, and even, sir, post-natal checkup also we provide. And not only that, sir, for anything related mother and child. If they come, they feel that after few months the baby is not well, they can always take the vehicle and go to the hospital. And at the same time, sir, keeping in mind that we see that most of the loss of life during this time is the late referral or the identification of the high-risk mother. So that's why, sir, we came up with the Mother app. In the Mother app, sir, it is, where we made sure that all the pregnant mother registered themselves, and the health practitioner, sir, they identify the high-risk mother, the date of the time of delivery, and that's how, sir, we track them. And after that, we track them, sir, and then we follow up the high-risk mother and make sure that, sir, that before the time of delivery, they should be properly informed. And like I said, we already have for the trained birth attendant as well, where we provide 1,000 rupees support to help them to take them to the transit home and wait few days until they deliver. So, sir, these are, I think, the initiative which we have been doing. And sir, please, I'll urge the member in the house, please, you can check yourself the Mother app. Right now, you can know that how many mothers are pregnant, how many in first trimester, how many are in second trimester, so on and so forth, and when is their expected delivery date. So that's how, sir, that we able to reduce. Sir, it is, sir, it's kind of a miracle, sir, to see that the kind of drop in the mother mortality rate. So for this, sir, once again, sir, I must thank the Honorable Chief Minister for his initiative to come up with the Mother program and the CM SMS.
Sir, last.
Yes, please.
Sir,
This question is taking very long time, already more than almost 40 minutes. So please, just please be brief. Don't
yes, sir.
stress too much. Yeah.
Sir, my small request to Honorable Minister through you, sir, this is very important, and I appreciate the initiative and the endeavor of the government and the health department. So my small request, sir, these are the important things. Knowing of all this, I've also given ambulance from my SRW 5 numbers.
Please come to the question.
So my question is, sir, so since the government has already given many vehicles for the police department and the education department, so why not one time given to all the PHC, CHC, enough ambulances? My small request, sir. That's all. Thank you, sir.
Definitely, sir, we'll look into the matter, sir. Even now also we are trying wherever possible, and sir, definitely will try to make sure that all the health facilities should have adequate ambulance services. And just to complete, sir, the question of the honorable member, I just want to inform him that even the ultrasonograph we have increased from 23 machine numbers to 85 in the state, sir, and we'll try to increase it more and to make sure that we saturated all the health facilities in our state, sir. Thank you, sir.
Barden, please. I can take only 2 more, from members.
Okay, just
One is
two only.
Elo is going
I
to
have
do
only
it.
two.
After that, I may not be able to do because this is taking
sir.
too much time.
I just want to know from the Honorable Minister whether institutional delivery is being conducted at the sub-center also.
Yes, sir, in the health and wellness center, wherever the trained nurses and A&M are there, sir, the delivery is being done, sir.
My second question, sir, is I would like to know from the Honorable Minister the number of transit home in each PSC and CSC.
So I don't have the breakup right now, but I can tell the overall transit home in the state is 170 numbers, sir.
No, sir, I want to know exactly in each PSC. So
I don't have the breakup right now with me, so that's why I'm saying the total number. But if you want, sir, I can lay it in table or the house, or I can provide it.
I would like to know from the Honorable Minister the status of the 3 MCH hospitals in Southwest Garo Hills, in Nongstoin and in Ribhoi district. Because, sir, the percentage of institutional deliveries is directly related to access to healthcare institutions and access to critical care.
So right now, regarding the Nongstoin and Umsting, sir, we are